And what's cool is that it's a very small diameter. And then the ones that are your chronic pain messengers, the ones that will say an arthritic knee, and you wake up every morning and it just kind of aches and it's sore. It's not the kind of pain that's going to make you, double over, but it's like you're aware of it and it's kind of achy sore. That's a different kind of nerve, but it's also a small diameter. And so what they've shown is that with really high power devices, like the class 4 devices, like the light force lasers, they have the ability with enough intensity on the superficial nerves that have these qualities, the chronic pain signalers and the acute pain signalers, it can actually quiet them down. So it's an analgesic effect that you get that lasts anywhere from 10 to 18 hours, depending on the dose and a couple different parameters. But they do the non-invasive treatment. You put this light on the skin. It just feels warm because it's high enough power that you'll feel a sensation on your skin. You'll say, hey, that's warm. If you've ever had a laser treatment where you didn't feel anything, that's one of the lower power devices, and that's a different animal. What I'm talking about is these higher power devices that when they put it on, there's enough intensity that you feel a warmth on your skin. That's, and if they're moving a handpiece around while they treat, that's indicative of it being one of these things I'm talking about. But because it can impact both acute and chronic nerve fibers and slow down that message that goes back to your spinal column to tell your brain, hey, I have a pain. It's like getting a lidocaine shot or like an analgesic shot that lasts.
Yeah.
And that's super powerful in the clinic. It's super powerful for you at home because you're going to get one of these treatments that only last a few minutes. But usually right after the treatment, you're going to feel a lot better. You're going to say, hey, you know what? I can move my elbow better, or I can move my knee better. It doesn't hurt the same way. And when that happens, then that opens the door to your therapist to be able to say, oh, okay, great. Well, since that doesn't hurt, now we can do these activities to help double down, get you moving a little bit, maybe work on some strength things, work on some different functional components that if you were hurting, they might not be able to do. So it makes your visit much more efficient, when you go to see a professional, because they can do more stuff because you'll hurt less. And then the nice thing is, since you'll be hurting less for hours after the session, you can then move better, move more normally, which is a very good thing for your brain. It tells the body, hey, I can move without this compensation, this pain I've been doing, which helps also with your overall pain signal and getting you feeling better. So there's that piece, which is pain, and the laser, even though it creates some warmth, you can use it on chronic and acute problems for that reason and get really good results to reduce your pain.